We are back on Jersey Central on the New Talk Radio 1450 WCTC, the voice of Central Jersey. My guest who is standing by on the Jersey Central Newsmaker hotline is a neurologist. He's also a pain expert who maintains a private practice in New York City. He's got a brand new book due out a little bit later on this year, and the title is what really kind of got my attention. It is called DEBACLE, Why Our Healthcare System is the Biggest Fraud Ever Perpetuated on the U.S. Population. And a title like that is going to get some attention. So let me welcome my special guest who is with us here, Dr. Emile Hiesiger, here on WCTC. Doctor, good morning and welcome, and thank you for taking some time to talk this morning. How are you?
I'm fine. Thank you for having me.
That is quite a statement when you call it the biggest fraud ever perpetuated on the U.S. population. How did we get to this point, Dr. Hiesiger? Talk about what led us to where we are now.
Starting way back in the 70s, we had a lot of merger or consolidation activity in the hospital sector, and a lot of that may have been necessary. You had a lot of small hospitals that were inefficient. But what we have now is all over the country, not just New Jersey or the Northeast, is less and less choice between large hospital systems for the average man on the street to go in and have, say, their knee fixed or something. They have these large systems. They are not transparent in their pricing. They don't tell you what it's going to cost to get something done. It's very difficult. In fact, studies have shown for a trained group of people to get information from these systems, and they charge much more money than, say, a doctor in an independent doctor in private practice or a small private practice clinic. As an example, a colonoscopy could be something like $2,000 more just for a facility fee to have it done, not only in a hospital but in a doctor's office that's owned by a hospital that's down the hallway from a doctor who's in private practice, because the hospital says once you're joining the hospital, we're allowed to charge facility fees, even though what is being done is the same thing as Dr. Jones's office 15 feet away. If you go through this on a generalized basis, imagine a colonoscopy. Let's say the fee is $13.83 compared to $6.25 in a community setting. Imagine blood's being drawn at $37 compared to $13 in a community setting. A simple lab test at times can be as high as 8 to 14 times higher than in a community setting. So an MRI of a knee could be anywhere from $500 to $1,000 more in a hospital MRI machine than a community setting. When I say a hospital MRI machine or a lab or a colonoscopy suite, I don't mean it has to be in the hospital. It can be in something owned by the hospital. And the hospital says, well, we need to charge more because we're open 24/7 and we have all these regulations and all these people. And my response is precisely why outpatient care should not be performed in a hospital system unless it's for very, very sick people who have a disease where they may be endangered not getting it in a more sophisticated environment. And that is very, very few. Why should you pay more for a cardiogram or a woman for a pap smear going to Dr. Smith's office in a hospital or an office owned by a hospital as opposed to a private practitioner down the street? It makes absolutely no sense. And the public doesn't know the difference in many cases because their insurance covers, they have deals, they cover what the hospital is billing, and they pass on the cost of the fee next year in the form of higher premiums. Premiums in America, on average, are going up at 3% a year. Workers' wages now are going up at about 2% a year, and over time, that costs some pain. And for some people, especially if they've got Obamacare or something, their premiums are going up a whole lot more than 3% a year. And part of that problem is exactly what I've just told you. So on one hand, we have a system where the people unknowingly are paying more and more and more to subsidize these large hospital systems. 60% of the profits of the revenue, of hospitals comes from outpatient, not inpatient care. That's not what they were designed to do. That's not what all those nurses upstairs are designed to do. All the ICUs, all the people there at 3 a.m. in case a trauma comes in case someone needs emergency heart surgery or neurosurgery. That's exactly why you should not have outpatient care going on in a hospital system. And certainly the fraud of saying, because I happen to own an office 10 miles away from the hospital, we're going to call it part of the hospital and bill accordingly, is utterly ridiculous. It's absurd. You don't have to be a doctor or an economist to think about it. So we have basically runaway prices in this country are associated to a great extent with increased pricing of hospital care. That's both inpatient and outpatient. And it's on average, even for Medicare, it's 60 160% more when the 70-year-old Mrs. Jones goes to a hospital and gets her cardiogram and her biannual checkup, as opposed to going to someone in the community. Colonoscopies for Medicare are 164% more in a hospital than in someone's office in a private practice.
How did we get here? We're just so non-conditioned, I think, Dr. Hiesiger, that if we're in a hospital situation or getting a procedure or a test, whether it's life-saving or not, we really don't do any window shopping or sticker price asking.
Precisely.
Asking why, well, what's this going to cost me, or why does that not cost me? We've been conditioned to not worry about the cost of things like this, and I think that's how this kind of started to snowball, in that, you know what, they'll just charge whatever the insurance company will pay and just go from there. How do we do? Do we change the mindset of the American patient and get them to start to be a little more savvy shoppers when it comes to their own health care?
Bert, if you went to buy a Ford, you'd go to 7 different dealers or 6 dealers until you got the best deal, wouldn't you?
Of course I would. Whether it was a car or a piece of furniture or anything, I'd shop around,
okay,
of course.
So why don't you, first of all, find a doctor that can take care of you on a personalized basis and who has your interest in mind? The doctors in the hospital may be very nice people, but their salaries come from how much money they bring in. Now, isn't that a conflict of interest?
If you break it down like that, yeah, there's some work there that obviously needs to be done. And this is all covered in your new book, Dr. Hiesiger?
Yes. Do you also know that only 25% or less Americans use apps on their phone to find out the cheapest pharmacy for drug X? Say amoxicillin or something.
Yeah.
Any drug, you can pull out an app on there's a couple of good apps on your phone, and you can tell you within 5 miles, whatever you want, 10 miles, 1 mile, what's the cheapest store to get product X. And Americans don't do that. They're lazy, yet they bellyache like mad, and they somehow don't understand the connection. You can go to the hospital and get anything done, and they say, "Don't worry, your copay is only $5 or $10. Don't worry about a thing." But next year, when you write out your premium check, the reason it went up is because you decided to get your care in the hospital as opposed to your outpatient care, I emphasize, as opposed to looking for a private alternative down the street.
I'm sure, yeah, man. I can't really wait to read more about this later on this year when your latest book called DEBACLE comes out. How will people be able to purchase this, and they could find your other books online too, Doctor?
One of them is out of print, but
okay.
The other one is still in print. It's called "Say Goodbye to Back Pain," and yes, you'll be able to get it from Amazon as any other book.
All right. The book again is called DEBACLE: Why Our Healthcare System is the Biggest Fraud Ever Perpetuated on the U.S. Population. So check it out from my guest, Dr. Emile Hiesiger. Doctor, thank you for the time this morning. Some very, very eye-opening stuff, and I greatly appreciate your talking to me today. Okay.
All right. Thank you.